Hello, my name is Xuemei Sui. I'm currently an assistant professor at the Department of Exercise Science, University of South Carolina. I am very pleased on behalf of my co-authors to introduce our new study on racial differences in the association between non-exercise estimated cardiorespiratory fitness and incident stroke. This paper will be published in the upcoming issue of Mayo Clinic Proceedings. We conducted this study to investigate the association between non-exercise estimated fitness and incident stroke in a national biracial cohort study of men and women. We analyzed data from the Reasons for Geographic and Racial Differences in Stroke Study, or REGORS. REGORS study is a national population-based longitudinal study of more than 30,000 American men and women, blacks and whites. They were recruited from across the United States between January 2003 and October 2007, 45 years or older, and oversampling of blacks and residents of the stroke belt, North Carolina, South Carolina, Georgia, Alabama, Mississippi, Tennessee, Arkansas, and Louisiana. The purpose of REGORS study was to determine the causes for the excessive stroke mortality in blacks and those living in the southeastern area of the United States. We use a non-exercise equation with age, BMI, waist girth, resting heart rate, physical activity, and smoking status to derive the fitness estimation. This non-exercise estimated cardiorespiratory fitness is similar in accuracy to cardiorespiratory fitness predicted from submaximal exercise tests. Incident stroke was identified through follow-up telephone interview every 6 months. Cox proportional hazard models were used to examine the association between fitness and the risk of developing stroke. During an average of 8 years of follow-up, among the 24,162 participants in the current study, 945 developed stroke. We found that non-exercise estimated cardiorespiratory fitness was a strong independent predictor of future stroke for whites, but not for blacks, where results were similar for men and women. A one-night increase in estimated cardiorespiratory fitness for whites was associated with a 12% lower stroke risk, but not for blacks. But for blacks, there was no benefit. A similar pattern of inverse association was also found for ischemic, but not hemorrhagic stroke among whites. We believe this is the first population-based cohort study showing an inverse association between non-exercise cardiorespiratory fitness and the risk of stroke in both sexes, and the first study to demonstrate a differential effect for blacks and whites for the association between fitness and the occurrence of stroke. In the United States, risk of developing a first stroke is nearly twice as high for blacks than for whites. Blacks have a lower level of cardiorespiratory fitness compared to whites and also have a less significant increase in fitness following an exercise training program. The association between fitness and stroke has been inconsistent among blacks and whites. We hypothesize the higher BMI, lower socioeconomic status, unfavorable lifestyle risk factors, and high CVD risk factor burden appear to contribute substantially to the racial differences in cardiorespiratory fitness. These differences might partially explain the non-findings among blacks in our study. However, we do believe more research is needed to explain the different findings between blacks and whites. Although cardiorespiratory fitness is recognized as an important marker of cardiovascular health, it is currently the only major CVD risk factor that is not routinely assessed in clinical practice due to feasibility and cost. Non-exercise estimated cardiorespiratory fitness might provide reasonably accurate estimates for initial cardiorespiratory fitness screening for stroke prevention. In addition, greater efforts directed at the understanding and improving cardiorespiratory fitness in Blacks are much needed.
We hope you found this presentation from the content of Mayo Clinic Proceedings valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you will find access information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.